Good morning and a very warm welcome to another one of our live webcasts, this time on complementary therapies for breast cancer. Before I start, I would like to acknowledge the traditional owners on the land of which we have host our webcast today, the Boon Wurrung and the Wurundjeri people of the Kulin Nation. I would like to thank and acknowledge the elders past, present and particularly those that are emerging who are a very important part of our network. This webcast is one that has generated much participation, and I first want to say thank you for joining us on a work day and so early. I want to remind you that this is live, so we want to hear as many questions as you have. So please follow the question box on your page now and keep sending them through as you think of them, and then we'll deal with them. My name is Kirsten Pilati. I'm the very proud CEO of Breast Cancer Network Australia. And today I am joined by two very important guests. We're going to hear firstly from Tanya Wells, who is a lead clinician at Melbourne Integrative Oncology Group. But very importantly to us is Jo Davey, a consumer who will talk about her own personal experience. But we want to get underway very quickly, so remember to keep sending your questions through. And Tanya, thank you so much for being with us today. You are a qualified naturopath. You've been practicing for over 20 years and you specialise in the research and development of integrative oncology programs utilising the best evidence base for complementary therapies to work in conjunction with conventional therapies. So it is so great to have you. Thank you for spending time with us on what is, as you know, a hotly debated topic.
Yes.
And one that many of our health professionals and members are really interested in. So I'm going to hand over to you to give us a quick 101 on complementary therapies.
Great. Thanks so much for inviting us here today, Kirsten. It's really fantastic to be able to actually just bring these things to the table and have a chat about some of the very common questions that we get asked all the time. So I'm sure there'll be more questions coming through as well as we talk a bit later. So I guess what we want to do is get on with our little slideshow. We've got a bit of a PowerPoint that we're going to go through a few very common questions and then we'll be able to chat with everybody through the live questions a bit later and answer any more that we haven't covered today. So this is just a brief outline. I guess one of the biggest things we wanted to talk about today was about the difference between alternative and complementary medicine. So complementary therapies are those that support the actions of conventional medicine. So they're meant to complement or go with or to enhance. So complementary medicines can be nutritional support, dietary support, exercise, acupuncture, herbal medicine, and these are usually supportive therapies during treatment and with no negative interactions. But of course they may or may not be supported by clinical research, and we're going to talk a bit more about what clinical research is in a minute. So alternative therapies tend to be natural medicines or natural therapies that are used instead of conventional treatments. They do tend to have that curative intent, so that means they're trying to cure that patient's disease, be it arthritis or cancer, breast cancer that we're talking about today. But sometimes there's not much research, and we have to be very careful about that. So I don't actually support the use of alternative therapies broadly. There are some things that may be of benefit to patients, but what we focus on is integrative care. So we're trying to add success to patients' outcomes and support them during treatment. So we use complementary medicine, and I think that's the safest way of applying natural medicine when you're dealing with breast cancer. So we rely heavily on clinical research. I guess when I first started 20 years ago, there was very little clinical research, and in a lot of ways there's little research now. But there is a growing body of evidence that shows that some complementary medicines support patients during treatment. And of course we want to utilise clinical research, which is research in which human volunteers participate in trials. We're very pro-research. We want to make sure that as many trials as possible are being utilised. And of course a huge percentage of our patients are enrolled in clinical trials, which can only add to the information that we can use to support other patients. So it's very important. So clinical research is where we're looking at an intervention and comparing it to either a placebo, so that's no intervention, or something different, another drug or another substance or another treatment. And analysing the results, seeing what the outcomes are, what the side effects were, and what the benefits were for those patients. So the most reliable information, I mean, one of the things that's very hard to determine when you're a patient looking for information out there is the reliability of information. We want it to be as reliable as possible. So, of course, human trials of patients in a similar situation to you, that's the research we want to look at. And human studies, of course, as compared to animal studies or test tube studies, which might not have a lot of relevance to a human body. So we'd like to see large sample sizes where possible. Although I don't want to discount the value of a case study. You know, sometimes there can be some brilliant case studies published that are able to be translated into the wider community as showing benefit for patients. And so we want to make sure it's relevant to your situation. That's reliable research, is clinical research. I guess what we do a lot in clinic, and I'm sure all of the clinicians out there who might be listening would totally agree with this, is that we've got patients who come with information that they've gathered. And of course, everybody can Dr. Google, which is fraught with danger, because although there's a lot of information, and certainly we're in the information age when it comes to what we have access to, being able to understand that information, being able to determine whether it's actually valuable and reliable information is really difficult. Like, this is such a difficult space to navigate at the best of times. So we need help to actually make our way through that research to determine whether it's actually going to be helpful for you or not. So we strongly suggest that you avoid Dr. Googling or miracle cures. A lot of it is not fact-checked, it's not necessarily evidence-based, and this is where we're really trying to distinguish between evidence-based natural medicines or evidence-based therapies that can be helpful and those that are not evidence-based. There's no research to indicate that they may be helpful, even test tube studies or animal studies. So like all medicine, complementary medicines can be harmful or they can be helpful. And I've certainly seen plenty of cases in clinic where patients have either been prescribed a natural medicine from a practitioner who's really not experienced in oncology, or they've self-prescribed something because of information that they've read online, and they've ended up with terrible side effects from that, which can make the whole experience just that extra level harder than what it already is. And we don't want anything to interfere with your treatment, so we need to make sure that complementary medicines that are chosen aren't going to interfere with the treatment that you're receiving at the moment. We're going to touch on that a little bit more in a second. So the role of complementary medicines in integrative oncology. So integrative oncology is a bit of a newish phrase, been around for 10 to 20 years, but I guess it's integrative medicine where we're utilising all of the available evidence-based medicines to support you in your condition. And I guess what we're trying to focus on is the use of evidence-based complementary medicines in order to achieve a number of goals. So we've got a number of goals in mind every time we speak to a patient. It might be to reduce the side effects of the treatment, anything from nausea to peripheral neuropathy. There's some fantastic support for reducing peripheral neuropathy, which of course, if you're on something like Taxol or any of the taxanes, can be a very real risk. So we're trying to reduce side effects of the treatment. There's also adjuvant action. So adjuvant means that it can enhance the outcomes of the treatment. There are some complementary medicines that are chemosensitizers or radiosensitizers, and they can support the action of conventional medicines. And then, of course, we've got supporting your recovery. You know, you've got other things going on. You might need support for your stress levels or sleep, or you just might be feeling anxious. We've got, support for kidney function and liver function, which might be compromised from treatment. And of course, there's also work, a lot of research going on about reducing the risk of recurrence. And of course, there's been some fantastic BCNA podcasts on fear of recurrence, and this is a real thing to focus on as far as doing whatever we can to reduce that risk of recurrence. So there are a lot of positive outcomes that can come from using complementary medicines when you are in the oncology setting. So there are some that are really great. So for example, vitamin E can reduce your risk of developing pulmonary fibrosis, which is scarring to the lung after having radiotherapy. But of course, we can't take vitamin E during radiotherapy. That's something that you cannot do ever, is take vitamin E during radiotherapy. But once you've finished radiotherapy, we do suggest taking vitamin E for a period of time, which can reduce that scarring of the lung. Other complementary medicines might be helpful for reducing peripheral neuropathy, digestive distress, fatigue, all sorts of other conditions. So there's a lot of positives that come out of using integrative oncology supports. But, when we look at, what complementary medicines or alternative medicines are most Googled at the moment, I guess one of the biggest ones is intravenous vitamin C, and I'm sure some questions will probably come through about IVC and its value. Medicinal cannabis, of course, everybody's talking about medicinal cannabis, CBD or THC, and the benefit of that in oncology settings, which there can be a huge benefit in using CBD and to a degree THC. But of course, we have to look at that research and scrutinise it to see, is it something that's a support? Is it going to help us with anxiety and sleep? Or is it actually a cure? And of course, there's not a lot of evidence to say that it's a cure. Curcumin and green tea extract, they're certainly complementary medicines that we use a lot in integrative care. SEACT, which is a very old school natural medicine, which is a nice detox support and can enhance well-being. Ketogenic diet, of course, is definitely the new fad when it comes to oncology, and certainly there is some evidence of benefit there, but not for all types of cancer. So I guess that's one of the big themes that we try to debunk, is that when it comes to natural medicine or complementary medicine or even diet, there is no one size fits all. There's no one diet. There's actually a different diet for ER-positive breast cancer than, say, triple-negative breast cancer. There's a different diet, certainly a ketogenic diet if you have a brain tumour compared to bowel cancer, which you should definitely not be ketogenic. Neuroendocrine cancers, you should absolutely not be ketogenic. So there's some research that we need to scrutinise to determine whether these things are helpful in your particular case. Fasting is very important, very interesting research. It's really newly researched, but there's very compelling evidence that shows benefit of fasting in some circumstances, especially around the time of treatment. But of course, everybody's talking about off-label use of drugs at the moment, which actually isn't new. It's a very old treatment, but everybody's certainly reading Jane McClelland's book and trying to get the most out of that. But again, the big message is that it's not for everyone. It's not for all types of cancer. It's not for every situation. So we have to be careful about that. So just a couple of debunking, bad advice and myth debunking. Sometimes you see a lot about a particular natural medicine online. For example, celery juice. If you go onto Instagram, you can't avoid seeing the next Hollywood star who's having celery juice diet to cure all the diseases. Starvation diet. And I do know of some other health practitioners who recommend fasts for 30 days. It's just very unethical and not evidence-based at all. So look, fasting in its fasting or low food intake for particular times of the chemotherapy cycle or in particular situations can be helpful, but certainly starvation diets, there's really not a lot of evidence about that. Gerson therapy, which is having multiple juices a day. Budwig protocol, which is another one where you have cottage cheese and flaxseed oil in huge amounts every day. And of course, black self, which is a topical preparation of herbs, which we really don't want to see. I've seen some very bad outcomes from black self. So many of these have an element of benefit. You know, there's often an element of benefit in having juices or in having a plant-based diet. Of course, we recommend that. But often when it's taken to that sort of dangerous degree, we have to be very careful about the use of that, because it can make you incredibly unwell and worsen your outcomes significantly. So I guess, as I said before, there is no one size fits all, and we really want to emphasise the individual need for support, that it differs between cancer types, whether you've got metastases or not, what your previous treatment has been, and if you have cancer types, whether you've got metastases or not, what your previous treatment has been, and if you have there's some interactions that we need to be very aware of, and we need to make sure that the practitioners that we see do have a good understanding of these interactions as well. So just a few tips, do's and don'ts as a final few slides. So when it comes to the do's, where to find clinical research, you know, this is the thing, that there is some good research online. There's some public medical databases that have research available, but of course it's all just gobbledygook if you're not coming from a science background. It's really hard to understand that research, and it's definitely important to have someone to help you go through that. But mostly what we want to do is make sure that you're working with experienced practitioners. You know, we want to have someone, if you're going to go and see a naturopath to get support for yourself during treatment for cancer, they've got to have a degree qualification. They do need to have professional association memberships, and making sure that they have that experience. Ask them about what they know. They need to know about interactions. They need to know about what normally happens in medicine. Medical treatments have good familiarity with the current medical model and be able to support you through those processes effectively and confidently, and in an evidence-based way. If they're giving the same treatment to everybody, irrespective of their type of cancer, that's when you've got to have a few red flags up as well. So the don'ts, don't just take something that your friend's neighbour recommended. As we said, treatments are cancer specific and also interaction specific. So something that someone saved themselves with prostate cancer is not necessarily relevant to breast cancer. Don't believe everything you read on the internet. I know that sounds a bit basic, but sometimes it's very compelling. You know, a lot of these research websites, they present information in a very emotive way, or it's very convincing. It sounds good. But if at the end there's a click here to buy, that's another one to put a little red flag up about. Just avoid self-prescribing. So this is where we need to check those interactions. And of course, we all take natural medicines. We might go to a health food shop, get a few bits of information there, but the person in the health food shop's not going to be aware of any drug interactions, so we need to be careful about that. And don't take someone else's medications. So this is something a bit new in that, you know, since there's been a lot of interest in off-label drugs, you know, someone's saying, oh, my auntie has metformin, I'll just take her metformin. Not a good idea. We need to make sure that we've got, you know, all the practitioners on board to make sure that if it's appropriate for you to have metformin and safe, then you get prescribed it for yourself. So thanks very much. I just wanted to do that introduction, and then we'll see what comes up since then.
Thank you so much. And there are plenty of questions coming through, so keep them coming through, and some really interesting ones already. And always what we had predicted, but always some little surprises for you as well, Tanya. But
no worries.
Before we get to those, Jo, thank you for being with us. Can you tell us a bit about your breast cancer experience and why this topic is so important to you?
Sure. So in 2018, I was diagnosed with breast cancer. I was ER positive, HER2 negative, if I remember correctly. That would be chemo brain working that everyone's probably aware of. The diagnosis was a real shock after I found a lump in my right breast. It all happened very quickly. I found a breast surgeon and was going to have a lumpectomy. Didn't know too much about what the road of treatment would look like ahead. I was lucky enough to have a friend who was actually a breast cancer nurse, and she said to me, there's someone that I've heard of. A lot of my patients see her, and when they go through treatment, they look really good. They look well. And she had just moved into a suburb very close to me, so that was basically how I found Tanya and the complementary medicine. And I thought I would just go and have a chat. I have to be honest, I was sceptical. I was unsure of my road of treatment that would be prescribed by my health professional ahead. Going to see Tanya, I think I had just thought in my mind, I'll just go and have a chat. Our chat was pretty much a lot of the information that Tanya has shared today. The main thing that struck me was that it was evidence-based and that it was complementary. And I really think they were the things that I didn't understand before I went in to see Tanya. Complementary that sat aside any treatment that I would be prescribed by my oncologist. So to me, that felt fantastic, because I actually thought, okay, well, this is going to be okay. It's not going to hurt, because my oncologist is going to know about this. It's not instead of, it's alongside. So that was a really important point. Tanya also spoke to me about the importance of actually showing the plan that she had devised to my oncologist. So that also gave me a lot of assurance that it was going to be approved again by the person who was going to be prescribing my treatment. I felt really lucky to have a space where Tanya seemed extremely knowledgeable. She rattled off the names of the chemotherapies that I was prescribed, and was able to inform me of what, not only the side effects I may experience, that was exactly what my oncologist had told me as well, but she explained in detail about these complementary medicines and about how they would actually sit beside, when I was having chemotherapy. This might be something you could take that would support you when you're feeling particularly nauseous. I was really impressed that everything was evidence-based. The plan was really, really succinct. There was a lot of information. So once I'd met with Tanya, once Tanya had explained to me what she did and how she worked, I felt really confident to give it a try. It's hard to know, obviously, because when I went through treatment, and I've only been through treatment once, so I don't know how I would have gone without this complementary medicine. But everything was very specific to what I was experiencing. So I was on treatment from Tanya that supported me for pre-treatment to get ready for treatment and what that would be like. Tanya also supported me very holistically, which that was something, I don't want to say that I didn't get that from my oncologist and my breast surgeon. I had a very supportive team of health professionals. They were wonderful. But Tanya even invited my children in to explain to them, help explain what treatment might look like, what mum might look like when she was going through treatment, and did they have any questions. And that was such a wonderful experience. That was very important. So it also made me realise that there was a very holistic view to what was going on. So that made me feel really confident in what was happening. There was a strict plan, exactly what Tanya really has showed in the PowerPoint previously about what was okay to take while I was having chemotherapy, what was not okay to take while I was having chemotherapy, that it would actually work against what the chemo was trying to do. So I followed that. I felt that I managed okay through my treatment. And like I said, I don't know otherwise because I haven't had treatment without this complementary medicine. What was really fantastic was through each stage of treatment that I went through, my plan changed. So when I was going pre-op, I had pre-op treatment to get my body ready for what was going to happen. I went through a mastectomy and a reconstruction. And the surgery was a really big surgery. I had a DIEP flap reconstruction. So I really wanted to get my body ready for this operation. It was a really big thing. Having this complementary medicine to take was fantastic because at that point I certainly wasn't prescribed anything from my medical practitioners to support my well-being of how to prepare for the operation. And it wasn't just particular herbs. It was also advice around rest. It was also advice around exercising. It was also advice around what foods are really good for helping you have some energy, helping build muscle. That information was really, really valuable to me. And it was certainly a really big learning curve. I had the surgery. I recovered really well from the surgery, and I continued seeing my medical practitioners and also Tanya. Currently at the moment, I am cancer-free. I still am on a treatment plan from Tanya, and that treatment plan is, in the best interest of trying to keep me cancer-free. So I guess this complementary medicine can be with you at the beginning, in the middle, and also post your treatment journey with medical health professionals.
There's so much to unpack out of both of your stories and experiences, and so many questions coming through. I just want to remind people that we need the questions to be general in nature, and that if you have any specific question about your own breast cancer experience, then we really want you to go and speak with your clinical team. So I've got some quick ones that we can address quickly around the vitamin E. So why can't you use vitamin E during radiation? And secondly, is it too late if you are 2.5 years later to start having vitamin E for radiotherapy scars now?
Okay, so the first part of that was about why can't you have it during treatment. So there's a lot of research into the use of antioxidants during radiation treatment. So obviously radiation is pro-oxidant. It's trying to create damage to that tissue in order to kill any cancer cells that are residual in that tissue. And so strong antioxidants may oppose the action of the radiation and stop it from working as well. Just a note on antioxidants, not all antioxidants are the same. There's some research that shows that some natural medicines which are, I suppose technically you can put them in the bucket of antioxidants, but they can be helpful during radiation. But with vitamin E specifically, there's 2 antioxidants very strongly that you shouldn't have during radiotherapy. One is vitamin E, the other is glutathione. And we're not sure about vitamin C, especially IVC during treatment. It's a very strong antioxidant. If you're going to have radiation, you want it to work. And so this is where we don't want any of those very strong antioxidants that may stop the radiation from doing its job. The research about the use of vitamin E is for the use of it for 1 year after having had radiation. Now we know that fibrosis can take a very long time to develop. It can take 5, 8, 10 years to develop. So I would say it's never too late. Even 2.5 years later, it would be helpful. But I guess the first year after treatment is actually the most important for the application of vitamin E.
I really like this question from Bianca.
Okay.
If these things work, Why doesn't my oncologist know about it?
Okay. So it's just because it's not covered in medical training. So I actually teach at Monash Medical School. I do teach a sort of supportive subject for medical students. And look, I know that their net learning about complementary medicines is about 6 hours over the course of their degree. They just don't have time to learn that kind of information. But I have to say that there are many oncologists out there, radiation oncologists or medical oncologists, who have a keen interest in using integrative oncology. And so they've done a lot of self-directed learning since they finished their course, but it's just not covered. So you will find that there are some oncologists out there who know a lot about integrative care and know about the things, and they do actually recommend those things. And I've certainly seen also surgeons recommending natural medicines in post-operative situations. And so it is evidence-based, and there's plenty of research out there, but you just don't get time to learn that as a medical student.
It's very interesting to me when I started at BCNAU some 15 years ago. The members were telling us about the real benefits they were feeling from acupuncture, and clinicians were kind of like, no research, nothing to see here. And now all of a sudden you go to international conferences and everyone's telling everyone about how amazing acupuncture can be for some of the side effects. And I think that sometimes we need to learn from each other and actually be involved in clinical trials that will help see the practice that some of our women and men who've been diagnosed with breast cancer are feeling to actually generate the clinical trial. Jo, you talked a lot about the kind of herbs and things. What about mindfulness, yoga, those other physical activities that can often be done to help?
The thing that Tanya and I spoke about that was really important, and Tanya made a real point of letting me know that exercise during treatment was really important. I guess anyone who knows, about going through some surgeries and the stress and the anxiety of it all, and then maybe having treatment and feeling very unwell, you don't want to exercise. I was able to do some really gentle walking, and then I was doing Pilates, and I found that really, really helpful. In terms of actual mindfulness, I didn't practice a lot of mindfulness specifically for what I was going through. I've always been someone who has been very conscious of my mental health, because I actually work in mental health in a professional capacity. So self-care was really important to me, and that was something that I was encouraged to do alongside my treatment from Tanya, and it was something I knew about, but it was also enforced, and it was just it just came.
And interestingly, Tanya, we've just been at a Reflections of San Antonio, and one of the things was said that how little supportive care research is being done. And I think Jo Online says, the absolute frustration from our membership. She reflects that of how there isn't enough being done in this area. Do you agree with that? Is there some things we should be getting excited about, some trials people can be involved in?
Yes, I mean, certainly there is a very low level of trials when it comes to really good clinical trials into integrative oncology care. And that's often because that particular therapy is not something very profitable. A lot of research is, financially driven, so we do need to focus on that. And certainly that's something to change about the scientific industry and the research industry. But there is research out there about the integrative use of acupuncture, certain herbal medicines. There's even research about the use of Bowen therapy or reflexology, exercise, massage therapies, certainly pre and post surgery having lymphatic massage and oncology massage. There's some research about that's underway. And certainly there is more research coming, and we recommend everybody participate where possible. And there's a lot of research undergoing now about exercise during and after treatment and its effects on your well-being and sleep and anxiety levels and so on. It can be very beneficial. But I guess this is the thing about research too, that years ago there was no research about anything in an integrative way, and we're saying, well, we think it's safe, but we're not sure. Now we've got clearer ideas about what's safe and what's not, but there's still areas where I'm like, well, all we've got here is an animal study. It seems to be that it's okay. There's nothing on humans, so we need to be careful about how we might extrapolate that information. So there's a lot of gaps. You know, if I think about all of the natural medicines that people are taking when they first come into my clinic, I would say that I would personally recommend maybe 2 to 5% of it based on research. So there's a lot out there that we have to be careful about. But we need more research, and so certainly if a nurse practitioner or an oncologist talks to you about potential research, it's definitely worth participating. It's going to help yourself and everybody else as well.
Yeah, and I should do a very big plug to Breast Cancer Trials, who has a very strong consumer voice that is feeding into some of the newer trials that they're looking at and really starting to say, no, this is what the actual patients want to know about, and letting that drive it. So some of the women and men who are on those trials are really important process of this. I also wanted just to plug, because you talked about getting ready for surgery, and it's one of the real benefits of Breast Cancer Network now having the My Journey online tool, which means the day that you're diagnosed, you can access information. And we recently released, with a very big clinical support, a prehab program, which is about getting ready before you have surgery. So please go on to our myjourney.org.au, log on and see some of that really important information, but also information about the clinical trials. The peripheral neuropathy.
Yes.
Any advice on how people can help, even if they've, post-treatment and they're still having the issues?
Yes. So certainly, even post-treatment, if you've still got residual peripheral neuropathy, it's not too late to do something about it in the most part. Now, I guess we're changing, and medicine is changing the way that it applies some of these treatments, knowing we used to think that originally that peripheral neuropathy was something that was just transient. It was just when you had chemo and then it would resolve. But of course, there are some patients that have it in an ongoing and certainly more permanent way. So if you still have residual peripheral neuropathy, there's a few complementary medicines that can be helpful to take nutritionally, and you'd need to see a qualified practitioner to get those, because some of them aren't available over the counter, and you certainly want to be careful about over-the-counter products because they may not be as high quality or the right dosage. But the other thing that's very important is acupuncture. So there's a significant body of evidence that shows that acupuncture can be beneficial during treatment, but also afterwards if you still have residual peripheral neuropathy. Exercise definitely is helpful, and just keeping the tissues warm. We're wanting to, and exercise helps with that as well. So there's acupuncture definitely you would start using, massage and physical therapies, exercise, and there's a couple of key natural medicines as well.
Are there any other side effects that acupuncture is actually helping? I know Peter has sent through a message saying, what does acupuncture, what's it actually useful for?
A lot of things. So acupuncture can reduce nausea, headaches during treatment. It can enhance energy during treatment. It's useful for reducing peripheral neuropathy symptoms. It can be useful for reducing anxiety. The list goes on and on, actually. It's very useful.
So it's a good one for you to go and talk to your clinician about whether it's right for you.
That's right.
Yeah. So there's so many questions coming through. I'm sorry. Vitamin D is obviously there's some of the side effects are actually around the bone density, and many people are prescribed vitamin D.
Yes.
What's your kind of advice around vitamin D, and who should be considering vitamin D?
Okay. So pretty much everybody who's on an anti-estrogen should be taking vitamin D. Even if your levels are okay, you need to take vitamin D to maintain those levels. In Australia, despite the fact that we have, most amazing sunshine and weather, We've got one of the highest rates of vitamin D deficiency internationally. So, and actually the vitamin D dosage or the vitamin D levels that you want to maintain when you're an oncology patient, especially if you're on an aromatase inhibitor or a tamoxifen, they're higher than what's average. You know, most of the time if we've got vitamin D levels of between 50 and 80 on our blood tests, everybody's happy. But we actually want them to be much higher than that when you're on an anti-estrogen, because you've got significantly increased risk of bone density loss. And so anyone who's on an aromatase inhibitor specifically does need to be taking vitamin D and a decent dose. So I guess most of the time you'll get an Ostalin or something like that, which is only 1,000 IU per day. We often need a little bit more than that, but at least that is helpful.
So if you do want more than that,
you'd have to see a practitioner to get that.
Yeah. Perfect. So another one is around, which, you know, I'm not sure around the vitamin D, but the joint muscle pain from Arimidex. What's some of your advice on trying to at least hold it at bay, if not reduce it significantly?
Yes, that's one of the key things that people come in and talk to us about. You know, we do recommend a range of complementary medicines that may be supportive for joint function. Chondroitin and MSM and some of the other nutritional supplements are very helpful for maintaining joint function. And certainly having an active life, so exercise significantly reduces their chance of developing, and it reduces the severity and the incidence of having joint issues around aromatase inhibitors. So exercise is probably the key treatment, especially weight-bearing exercise. I know that, you know, when you're on an aromatase inhibitor and you wake up feeling like an old lady at the best of times, it's not the first thing on your to-do list to go and do an exercise program. We're understanding about that, but at the same time, you know, after you've warmed up in the morning, having actually some weight-based training or body weight training, that's actually the best treatment for that.
Jo, what's your tip about getting past the feeling like an old lady in the morning?
Well, actually, exactly what Tanya just spoke about, because I'm currently still on treatment on tamoxifen and Zoladex, and I've certainly experienced a lot of joint pain. And exercising has been great. Exactly what Tanya said. I don't really love to do it the first thing in the morning, but weight-bearing exercises, has been really helpful in my experience.
What kind of weight-bearing exercises are you doing?
I do at the moment? Well, I've actually just started in a new gym, so I'm given all sorts of exercises. Some of the exercises are just using my own body weight, so they might be, you know, things like lunges and push-ups, but some of them are actually with small weights. So there's a whole different range. I think you can, you know, you could even just go to your local gym if you wanted to, but you can actually get some things online as well with weight-bearing exercises that you could actually do at home. But I have found that really helpful.
I know Rob Newton at our conferences and information forums around the country. Rob Newton's a West Australian, well known for his work into research around exercise. Says if exercise was a pill, everyone would be taking it every day, and it's so much easier said than done, right?
Absolutely.
Yeah.
Of course.
So one of the other challenges or barriers mentally for people around exercise is not knowing what they can and can't do post a diagnosis. What kind of advice would you give on that?
I highly recommend seeing exercise physiologists, because that way they're, you know, as much as, you know, when you're at your stage, Jo, it's okay to go down to the gym and have someone support you, a personal trainer, but that's not appropriate when you're in treatment or if you've got significant medical issues that you're dealing with. So an exercise physiologist is able to tailor a exercise plan for you. And this is the thing about exercise. We know its benefits. We look at the research, and the research says even if you've never exercised in your life and you're diagnosed with breast cancer, if you start exercising then, it can reduce risk of recurrence by 50%, much higher than any other treatment, any other drug, anything. It's like the number one treatment. But we've got that barrier of actually saying, well, what do? I've never exercised before. I feel terrible. How am I going to exercise? What can I do? I've got a sore back. I've already got a sore knee. How am I going to do this? definitely we need to speak to an exercise physiologist who has specialty in the oncology setting. They've got so many skills beyond what you would get from a gym because they're degree qualified or master's qualified in this area. They tailor you a program, take you through it safely, make it fun, you know, and then you've got that research-based program to support you. And it's those programs tailored by the exercise physiologists that have the best outcomes.
So I know we said number one is exercise for joint pain. Is there a number two, a number three, other options as well?
Number two would be omega-3 fatty acids, fish oils. I mean, I do prefer to get the most of your nutritional intake from food. If you can eat fish, that's great. We certainly prefer the smaller fish. We prefer not to consume the larger fish like swordfish, tuna and flake because they're high up the food chain and there's the higher risk of heavy metal content in those fish. But certainly having more of the little fish and sustainable fish populations as regularly as possible, at least every second day, would be very helpful. I find that I've got a little arthritis in my thumb and I notice that it's not aromatase inhibitor induced, but, you know, I notice that comes up when I'm not eating enough fish. So, like, even that one thing can make a big difference to how your joints feel. So my number two would be fish oil, definitely.
Vitamin C keeps coming up. You talked a bit about it in your presentation. I think it's one of those ones that comes up a lot at our forums, but obviously people are seeing information through Google around vitamin C. What is safe? What isn't? And what are the really practical tips for people? Because I think there's a lot of confusion online around intravenous vitamin C, but also taking vitamin C tablets.
Yep. There's often not a lot of risk around taking vitamin C orally. Most of the research that looks into interactions is with respect to IVC. And it's one of those things that's really hard to answer in a 10-second snippet because it is case-specific and drug-specific and cancer-specific. And there's things that we don't know. So we do know that certainly between chemotherapy treatments, having vitamin C can be very beneficial for alleviation of fatigue symptoms. It can help with recovery in that way. But there's, you know, questionable research about using it on the day of chemotherapy, and certainly there may be some interactions with chemo and certainly radiation therapy. And I guess we have to think about it in a safe way. We go, look, it can be helpful for fatigue, it can be helpful for recovery, it can be helpful, you know, higher dose can be anti-cancer. But again, the clinical research is lacking. It's a lot of animal studies. And so, you know, we've got plenty of evidence about it being useful for fatigue. Just an example of how we have to be careful is that I've got a patient who's on palbociclib and letrozole for treatment for her ER-positive breast cancer, metastatic breast cancer. And, you know, there's no research at all about the use of vitamin C with palbociclib. So the way that we've negotiated between the oncologist and myself as to what's the most appropriate for her, in her week off palbociclib, she has a massive energy slump. And so a couple of days after she's finished her palbo, she has an IVC infusion, and that just gives her that fantastic energy boost. It's not a high dose, it's just a tonifying dose, and she gets it from a qualified IV clinic. And so that's something that can be helpful in that kind of situation. There's no risk of an interaction with palbociclib because it's out of the system by then. So again, we have to sort of tailor the treatments according to the patient. So there's absolutely no one size fits all, unfortunately, sorry.
But there is one thing we know for sure, that having vitamin C alone will not cure your breast cancer.
No.
And I think it's a really important message. And we see over time these kind of fads. You know, when I started out in the cancer area, it was about apricot kernels.
Yes.
And we were able to, with the work of the Cancer Council, actually stop people from misinforming the public on treatments. And sadly, for that, many clinicians are reporting to us that actually people are coming to them now wanting to do only alternative therapies and have no conventional treatment. And I think it's very important that people understand the consequence of not having conventional treatment, and that complementary is about living a better life and looking at the quality of life as opposed to doing it instead of your treatment. We are running out of time, but I am going to take a few minutes over, which I'm sure the team are not going to be happy about. Metastatic patients.
Yes.
It's a much more confusing, you've already talked about the Pelbo situation, it's a much more confusing area for them. What advice do you give to metastatic patients around what complementary therapies they should be doing and what they should really steer away from?
I can't actually answer that question because, again, it's case specific. But when it comes to metastatic situations, there's always things to be done. So there's always ways of adding success. I mean, you talked about that, you know, we're wanting to improve quality of life and wellness, and that is one part of what integrative care is about. But now there's research coming up that says actually we can add success to that plan. We might be able to add, you know, 2% benefit here, 3% benefit there. And so there's always things that can be added. And I guess we want to focus a little bit less on just taking pills. You know, we don't want to just take pills. We want to have the most appropriate diet, exercise program, acupuncture, massage, psychology support, all of these holistic team. You know, you need a team of practitioners to support you during that time. And so we're focused mostly on that. So it's not necessarily about, oh, take vitamin E and everything will be sweet, you know, you'll get better outcomes, but it's more about making sure that when you've got metastatic disease, it's complicated. We need to have that regular support with psychology support, or it might be acupuncture once every fortnight, and that's the best medicine for you. So the best medicine might not be a supplement. It might be a combination of other allied health therapies. So there's always something to do. What that is an individual assessment.
So I do want to wrap up, and I'm Joe, I'm just giving you a warning that I always get the consumer to speak last about some practical tips. I'm giving you a bit of a warning.
Okay.
Tanya, people want to know, how do they find degree qualified naturopaths who have experience in this area? We know we're in Melbourne. How accessible are you, and how do people actually find someone that's going to give them the best support and work within their whole multidisciplinary team?
Yep. So I don't know is the answer to that question in the big scheme of things. I guess when it comes to our clinic, I'm very fussy about who works in the clinic. I make sure everybody is degree qualified. We've got a team of practitioners there who are supportive in each of their roles. And certainly you can check databases like the National Herbalist Association of Australia database to see whether they do have a degree qualification. You can ask that practitioner to look at their degree, have a look at the letters after their name, you can always check these things online or ask to see their qualifications. But I guess you get the most information from having a conversation with someone about whether they do really know about the industry and the medical model and how it works. From a perspective of, we don't just see regional patients, I would say that, local patients, I would say that even though our clinic is in Carnegie in Melbourne, we actually would have close to 50% of our consultations are online. So we have Zoom consultations, and they can be anywhere around Australia regionally, and we've got patients from New Zealand and Singapore and all over as well. So there's no problem with access to practitioners. It is a bit harder when you've got an exercise physiologist, or acupuncture obviously has to be someone local to you. And acupuncture, you don't really have to find someone who's specific for oncology. Most acupuncturists will be able to access information that helps them determine what's the most appropriate treatment.
Can you have acupuncture if you have lymphedema?
Yes.
Great.
Although one thing that we have noticed and that we've been trialling in the clinic is that if you've got lymphedema, sometimes the acupuncture doesn't work as well. That's the whole issue, because you're not getting that same reactivity. But one thing that we've been trialling a bit is to have a lymphatic massage first or the day before, and then you have your acupuncture afterwards, and that does seem to have good outcomes. So having a clinic where you can have both, one after the other, might be your best bet to get the most out of acupuncture.
There has been quite a few questions around lymphedema, and we aren't going to be able to cover them all today, but I would encourage people to watch another of BCNA's webcasts on lymphedema, which gives very practical advice on how you can help prevent but also manage lymphedema. And not, Janice, I promise you, it's not just exercise, although that will be an important part of it. So, Jo,
Yes.
your tips for people in waging through what is a really complex and unclear in many situations, your practical tips on how people should navigate their way through complementary therapies if they're in treatment and then post-treatment.
I think I probably just need to reiterate what Tanya shared in finding someone who has an interest in oncology. I think also that uses evidence-based practices. They'll be able to explain things in such a clear way for you. And also, that also shows that there's a possible connection between your complementary therapist and also your oncologist. So you've got them actually working together. Be mindful that every step of the way you can actually have complementary medicine before you begin treatment, whilst you're going through treatment. And the complementary medicine, I guess, as Tanya said, isn't just about taking herbs. It is about maybe going to see someone else to talk about nutrition, addressing that, different types of exercise that's going to work for you at that stage. And then you're moving on to the next stage, exactly like you are with your traditional medical, conventional cancer treatment that your oncologist has prescribed. There is also something else. Your complementary medicine is going to change as well. So I guess I don't have any, overly wise words, but, I think if you're open to experiencing it, give it a go. My experience was really positive. It's continuing to be positive. I'm still on a treatment plan, and no doubt that may possibly change, depending how I'm feeling, what's going on in my life, emotionally, physically. So, yeah, I would encourage people just to explore it a little bit. Yeah.
And there were some questions around follow-up care, and I want to say that, once again, it's a big topic, and so we actually have covered some of this in our resources at BCNA for our podcasts and our webcasts around how do you actually manage that whole life after, when the doctors tell you to head back to back to your life, and you're like, what life? And that's anxiety and everything that we know so much about, and whether what you're actually feeding yourself, what you're doing for yourself, is working to reduce your risk of a recurrence. So I would encourage people to go onto our My Journey online tool at myjourney.org.au and check out all the information we have around reducing your risk of recurrence as well. So there has been so many things we've covered in an hour. We were only meant to go for 45 minutes, so sorry. But I think the key tips are not one size fits all. We need to make sure that we continue to invest in the research in this area. And I would really encourage people to get on at Breast Cancer Trials and check out some of the trials that are available, and really encourage your oncology and your multidisciplinary team to consider complementary therapy for you as a whole person, and that isn't just about taking herbs, but also about other things you can do for your mind and your body as well. So it has been an absolute pleasure. Thank you for all of the questions that have come through. They've been extraordinary, and I think we've covered a lot in a very short time. So if you need any additional help, please know you can call BCNA's helpline on 1800 500 258 and speak to an experienced oncology nurse who can help you to navigate your own personal experience. That's 1800 500 258. Thank you again, and we look forward to seeing you again next time.